The thing about the effect of environment on our health is that there are parts of it that are in our control, such as choosing to go to parks, going outdoors to spend time there. But there are also a lot of things about the environment that are out of our control, such as the level of air pollution, what's being built around where we live. But in today's video, we're going to cover things that we have control over and how we can use the environment to help improve our health. This is the Healthy Living Expo 2024, and I'm your host, Dr. Kristal Lau. And together with my partners Holly from IntuEats and Giota from Glam Beauty, we bring you this video mini-series to guide you in creating a healthy lifestyle while stationed in Germany. For us to get a bearing on how the environment can affect our health, let's look at the definition of health as per the WHO. Health is the state of complete physical, mental, and social well-being, not just the absence of disease. So you could be free of sickness but still be in poor health if your physical health, your mental health, and your social well-being isn't where you want it to be. The environment can play a role in helping these, especially while you're stationed here in Germany, because there's so many beautiful places for you to visit. The picture here is Berg Eltz, and it is about an hour and a half away from Wiesbaden. There is a beautiful trail from the car park leading up to the castle. And a lot of times while we're stationed out here, we want to explore. So there is a high chance we will go have some friends or family with us and go out to explore these places. So you hit three in one go by exploring here in Germany. You go out to do physical activity from hiking and walking. It's good for your mental health, and you get some of that social connection when you head out with your loved ones. So if you're interested in including going back to nature and getting reconnected outdoors as part of your health plan, you can work together with your primary care provider or any of your health providers to come up with a nature prescription that can help you tailor an outdoor exposure plan that fits with your health goals, especially if you're trying to treat and manage a health condition. Now, the idea of prescribing nature is not a new concept. It's something that has been around, especially in Japan, since the 1980s, where the physicians and doctors actually prescribe forest bathing as a therapeutic method for preventing health conditions, preventing illness, and to maintain health as well. So think of nature prescription as a very specific goal planning tool that focuses on the outdoors and the environment, and that ties into your overall health plan. To get started with your nature prescription, there is a very good template at parkrxamerica.org. The link is in the YouTube video description. You can come up with this by yourself and then bring it to your health provider or primary care manager to refine it, or just bring the template itself and work on a plan with them. One thing I do recommend is to give yourself a reward at the end of this prescription or of this goal, because it is a great way to motivate yourself towards achieving this particular goal, towards getting more outdoor time and getting more in tune with nature. And now I'll briefly touch on the aspect of our environment where things are very likely out of our control. So whenever you're living while you're stationed here in Germany, whether it's on post or off post, and there are things happening within your dwelling or around where you're living that directly or indirectly affects your health, here are ways that you can advocate for your well-being. There are two systems for our garrison, the ICE Command System and the Army Family Action Plan Program. These are two great ways of bringing up your concerns and having them heard and responded to. Now, if you are experiencing something that you feel can be directly improved by a program or service by garrison, then submit an ICE comment. If you think that a problem you're facing is larger and it affects the whole community or even outside our garrison, then submitting your concerns to the AFAP or the Army Family Action Plan Program is a great way of escalating your concern. Other ways to advocate for your health while you're stationed in Germany is to volunteer, because that is a great way for you to really represent your demographic in our garrison. And consider joining your SFRG2, the Soldier and Family Readiness Group, because once again, this is a platform and avenue that you can bring up your concerns and have them heard by leadership or higher. Now, if you want to learn more about the Army Family Action Plan Program and how you can be part of it or how it can help you, please visit my blog post where I wrote about my experience in taking part in the AFAP conference back in 2022. Thanks for watching the video, and if you missed out on the expo, sign up for our email in the link in the YouTube video description to get the content and updates.